Nunca más comas esto. 3 alimentos que destruyen tu próstata e impiden que orines. If you find yourself compelled to get out of bed multiple times each night, perhaps 2, 3, or even 4 times, to visit the bathroom, and if the stream of urine seems to lack its former vigor, as if your bladder has lost its youthful strength, and if you consistently experience that unsettling sensation of never quite feeling completely empty, then I urge you to pay very close attention to what I am about to reveal. What I will share may sound astonishing, even bordering on the unbelievable, yet it is thoroughly validated by medical science. The true culprit behind your nighttime disruptions, the source of embarrassment when you experience occasional leaks, and the underlying cause of that gnawing anxiety when you are away from home and desperately seeking a restroom, is not to be found in any prescription pill or surgical recommendation. Instead, the responsibility lies with 3 very specific food items. Yes, just 3. These are foods that you likely consumed this very morning, that you will probably eat again tomorrow, and that you will continue to consume daily throughout your life unless you are made aware of the unvarnished truth right now. These 3 food items are silently, invisibly triggering a chemical reaction within your body that is progressively constricting your prostate, weakening your urinary control, and systematically robbing you of your dignity in such a gradual manner that by the time you recognize the severity of the problem, years of suffering will have already passed. However, here is the pivotal aspect that can change everything. Once you identify precisely what these 3 hidden adversaries are, and once you grasp the exact mechanisms by which they are operating within you at this very moment, you will be empowered to make a decision that has the literal potential to restore to you uninterrupted nights of restful sleep, to liberate you from the anxiety of long journeys, and to free you from the embarrassment of urgent bathroom needs during important meetings. I have personally witnessed men who, after completely removing these 3 detrimental elements from their diet, managed to reduce their nocturnal awakenings from 5 per night to 0 in less than a month. They regained a sense of control they had long believed was lost forever, and reacquired a vitality that reminded them of their younger selves, perhaps 20 years prior. My name is Dr. Natalia de la Cruz, and if you wish to continue receiving vital health information, particularly concerning your well-being after the age of 60, I encourage you to subscribe to this channel and activate the notification bell. Now, before I disclose the exact 3 items you should immediately eliminate from your diet, there is a fundamental concept you must first understand. Without comprehending this core mechanism, any list of dietary restrictions will appear as arbitrary and senseless prohibitions. What is happening inside your body is not a matter of random chance. Every time you bring food to your mouth, you are making a biochemical decision. You are consciously or unconsciously choosing to either activate or deactivate inflammatory processes. You are determining whether your prostate will swell further or whether it will have the opportunity to rest and recover. The truly devastating aspect of this situation is that the vast majority of men over 60 are unknowingly making the wrong biochemical choices with every meal they consume. Your prostate is a small gland, roughly the size of a walnut, that encircles your urethra, the tube through which urine exits your body. When this gland becomes inflamed and enlarged, it effectively squeezes this vital tube. Imagine someone placing their hand around a garden hose and progressively tightening their grip. Water will still flow, but with significantly reduced pressure, requiring more effort, and often in an interrupted manner. Herein lies a crucial point that medical professionals often fail to elucidate with sufficient clarity. This enlargement is not an inevitable consequence of aging, as you may have been led to believe. This entire process is being actively fueled by 3 interconnected mechanisms that are entirely within your sphere of influence and control. The first mechanism is chronic systemic inflammation, which circulates throughout your bloodstream and directly attacks your prostate. The second is metabolic dysregulation, referring to the way your body begins to falter in its processing of sugars, fats, and hormonal balances. And the third is direct chemical irritation of your bladder. Now, for the truly game-changing revelation. The 3 food items I am about to reveal are simultaneously targeting all 3 of these vulnerable points. One of them triggers a significant inflammatory cascade, leading to prostate swelling. Another disrupts your hormonal equilibrium so profoundly that your body begins to produce excess prostate tissue uncontrollably. And the third directly irritates your bladder on a chemical level, causing a persistent sensation of urgency even when it contains only a minimal amount of urine. Do you now understand the profound devastation these three culprits can inflict? It's not a singular adversary, it's a multi-front assault happening concurrently. And the most alarming reality is that millions of men are consuming all three of these detrimental items on a daily basis under the misguided assumption that they are either harmless or even beneficial. How many times have you been told that prostate issues are an unavoidable part of aging after 60? How often have you been made to feel that your only recourse is to resign yourself to this fate and perhaps eventually to undergo surgery? This narrative is incomplete. While age certainly plays a role, your diet exerts an equally potent influence, and dietary choices are decisions you make 3 times a day. Extensive medical research has unequivocally demonstrated a direct and undeniable correlation between specific dietary patterns and the accelerated worsening of prostate symptoms. Men who suffer from metabolic syndrome face a dramatically elevated risk of developing problematic prostate enlargement. And do you know what is a primary driver of metabolic syndrome? Precisely the same 3 food items I am about to disclose to you. This realization is revolutionary. If you can successfully improve your metabolic health and effectively reduce the systemic inflammation within your body, you are simultaneously alleviating the pressure on your prostate. This is not a matter of magic, it is fundamental biology. Now, let us move directly to the first enemy, and I guarantee this revelation will surprise you because it is highly probable that you have been consuming this item throughout your life, completely unaware of its detrimental impact. The primary enemy of your prostate is not sugar in its broadest sense, but rather a specific type of sugar that is insidiously hidden in places you would least suspect. I am referring to added fructose, found in industrial syrups that are pervasive in soft drinks, in juices that falsely claim to be all natural, in biscuits, breads, and the very sauces you likely use every day. I am talking about that soda you habitually drink after lunch without a second thought, or that bottled juice that you were convinced was pure fruit. Let me meticulously explain precisely what transpires within your body when you introduce significant quantities of fructose. Fructose is metabolized almost exclusively by your liver, and this metabolic process generates inflammatory molecules that are then released into your bloodstream. These molecules travel throughout your entire system, and upon reaching your prostate, they initiate an inflammatory response. Your prostate swells, becomes irritated, and grows in an attempt to defend itself. But the damage does not stop there. Fructose actively promotes insulin resistance. And when you are insulin resistant, the levels of cellular growth factors in your body escalate to dangerously high levels. These growth factors act as a potent fertilizer for your prostate, stimulating its uncontrolled growth. Do you see how all these processes are interconnected? By consuming processed fructose, you create chronic inflammation, you disrupt your metabolic hormones, and your prostate becomes the ultimate victim. Scientific studies have unequivocally shown that diets high in fructose lead to the infiltration of inflammatory cells directly into prostate tissue, and in humans, the habitual consumption of sweetened beverages has been strongly associated with a higher incidence of metabolic syndrome. Therefore, if you regularly consume 2 large sodas daily, if your breakfast includes industrial juice and processed cereal, or if you indulge in sweet pastries every afternoon, allow me to state this unequivocally: you are actively exacerbating the problem. You are directly fueling the fire of prostate inflammation. What is perhaps most disheartening is that many men genuinely believe they are making healthy dietary choices. They perceive a bottled juice as beneficial, but if it's industrially produced, it is likely laden with concentrated fructose devoid of any natural fiber. In essence, it can be almost as harmful as consuming a sugary soda directly. So, what is the actionable solution? Immediately and completely eliminate all sugary beverages from your diet. Substitute them with pure water, water infused with fresh lemon slices, or unsweetened green tea. If you crave something sweet, opt for whole fruits, which retain their beneficial natural fiber. Examples include fresh blueberries, strawberries, or whole apples. The fiber in these fruits slows down sugar absorption, preventing the drastic metabolic damage caused by concentrated fructose. Men who have implemented this single change have reported significant reductions in urinary urgency and fewer nighttime awakenings within just 2 to 3 weeks, as they are effectively removing the primary fuel source for inflammation. But the detrimental effects do not end with sugar. There are two more equally dangerous adversaries, and they are likely present in your kitchen right now. Before I proceed, it is crucial for you to understand something important. If you find this information overwhelming, or if you require a clearly structured guide to implement these changes without confusion, I have prepared a comprehensive resource specifically for men like you. It is titled The Medical Guide to Avoiding Mistakes That Damage Your Prostate After 60. Within this guide, you will discover a step-by-step plan, detailed lists of foods to avoid and those to embrace, practical strategies tailored for different times of the day, and direct answers to the most frequently asked questions. You will not have to guess or experiment. Everything is explained in a medically sound, clear, and immediately applicable manner. The link to download this guide is conveniently located in the description of this video. Consider it a professional tool that will accompany you on your journey toward transformation. Now, let us delve into the second enemy of your prostate. This second adversary is in fact a category of foods that millions of men consume daily without any critical consideration. I am specifically referring to high-fat dairy products such as rich cheeses, whole milk, cream, and ice cream. Additionally, this category includes industrially processed meats such as cold cuts, sausages, hams, and smoked meats. Let me explain the underlying mechanisms at play here. Dairy products, particularly those rich in fat and calcium, have been consistently linked in numerous research studies to an increased risk of prostate issues. The reason for this association lies in their direct influence on the levels of a growth factor known as IGF-1. This factor essentially acts as a cellular fertilizer, promoting uncontrolled prostate growth. Furthermore, the saturated fats abundant in fatty cheeses and red meats actively contribute to chronic metabolic inflammation. Now, let's address processed meats, where the situation becomes even more concerning. When meat undergoes industrial processing, such as smoking, curing with nitrites, or cooking at extremely high temperatures, it forms chemical compounds known as heterocyclic amines and polycyclic aromatic hydrocarbons. These compounds have been demonstrably linked to an increased risk of prostate abnormalities. I am not suggesting that consuming an occasional sausage will irrevocably ruin your health. My point is that the habitual, chronic, daily consumption of processed meats creates a toxic, inflammatory environment that your prostate cannot ignore. And there is another devastating factor. These foods promote abdominal obesity. This abdominal fat is not merely an aesthetic concern, it is metabolically active. It continuously produces inflammatory hormones, disrupts the delicate balance between testosterone and estrogen, and directly contributes to the worsening of your prostate symptoms. Therefore, what is the recommended course of action? Drastically reduce your consumption of full-fat dairy products. If you consume milk, opt for low-fat versions or plant-based alternatives that are free of added sugars. Moderate your cheese intake. You do not need to eliminate it entirely, but avoid consuming large portions of cheese every single day. Regarding processed meats, strive to eliminate them as much as possible. Replace them with omega-3 rich fish such as salmon, sardines, or mackerel. These fish contain anti-inflammatory fats that actually protect your prostate rather than attack it. Incorporate more legumes as a protein source, such as lentils, chickpeas, and beans. Use extra virgin olive oil instead of butter. Enjoy fresh avocado, consume natural nuts and seeds. This dietary shift will not only benefit your prostate, but will also simultaneously improve your cardiovascular health, lower your blood pressure, aid in weight management, and boost your energy levels. It is a multifaceted victory. However, we still have the third enemy to address, and this one has the most immediate impact. It is the enemy that can manifest its effects within mere hours. It is the direct cause of those sudden, overwhelming urges, those embarrassing accidental leaks, and those seemingly endless nights where you wake up every hour and a half, unable to find rest. The third enemy of your prostate is the combination of caffeine and alcohol. I am aware that many men find this information difficult to accept, as their morning coffee is often a sacred ritual, and weekend beers are an ingrained part of their routine. However, it is imperative that you understand precisely what is occurring. Caffeine is a potent stimulant of your nervous system, and one of its most problematic effects is its ability to dramatically increase the sensitivity of your bladder. This means your bladder signals the need to empty much more rapidly, even when it is not objectively full. It is akin to artificially lowering your bladder's tolerance threshold. You consume coffee in the morning, and within 30 minutes, you feel an urgent need to urinate. You drink more coffee in the afternoon, and by nighttime, your bladder is so hypersensitive that even a minimal amount of urine will awaken you. Official urology clinical guidelines strongly recommend significantly reducing caffeine intake as one of the primary measures for managing symptoms of an overactive bladder and urinary frequency. This is not my personal opinion. It is an internationally recognized medical protocol that consistently yields positive results. Patients who have reduced their coffee consumption from 4 or 5 cups to just 1 cup in the morning report dramatic improvements within days. Now let's discuss alcohol, where the situation becomes even more complex. Alcohol exerts 2 devastatingly negative effects. Firstly, it is a potent diuretic, meaning it increases urine production. Secondly, it chemically irritates the lining of your bladder. Therefore, if you consume alcohol, particularly in the evening, you will inevitably wake up multiple times to urinate, not only due to increased urine output, but also because your bladder is chemically irritated. If you already have an enlarged prostate constricting your urethra, this combination is simply disastrous. So, what is the recommended course of action? Limit your coffee intake to a single cup in the morning. Completely avoid energy drinks, as they are overloaded with both caffeine and sugar. Significantly reduce your alcohol consumption, especially in the evenings. If you desire a warm beverage, opt for decaffeinated tea, herbal infusions, or warm water with lemon. This single change can have your nighttime awakenings within days, and when you begin to sleep through the entire night, your quality of life will improve dramatically. Now, I want to illustrate how all of this translates into real-world positive outcomes. I had a 64-year-old patient who presented at my office feeling utterly defeated. He confessed, "Doctor, I have accepted that this is simply a part of getting old." He was waking up 5 times every single night. His wife had even moved to a separate room because his constant trips to the bathroom were disrupting her sleep. Upon reviewing his diet, we discovered that he was consuming 2 large sodas daily. His breakfast consisted of sweet pastries with extremely strong coffee. He was eating processed meats almost daily and drinking beer 3 to 4 nights a week. I proposed a simple regimen: eliminate the sodas and replace them with water, reduce his coffee intake to 1 morning cup, switch from processed meats to chicken or fish, and reserve alcohol for truly special occasions. Within 3 weeks, he returned with a visibly transformed demeanor. His nightly awakenings had decreased from 5 to just 2. He happily shared that his wife had returned to sleeping in their shared bedroom, and he experienced significantly more energy, finally benefiting from restful sleep. In another case, a 68-year-old man suffered from recurrent prostatitis, experiencing painful infections every couple of months. He was exhausted from constant antibiotic treatments. His diet was heavily reliant on cheese at every meal, daily consumption of red meat, and very few vegetables. I advised him to incorporate fish at least twice a week, increase his vegetable intake, moderate his cheese consumption, and add blueberries and pomegranate to his diet. Within 2 months, he had not experienced a single new infection. His urinary flow had noticeably improved, and he shared a sentiment that I will never forget. Doctor, if I had known years ago that something as simple as changing what I eat could make such a difference, I would have done it immediately. Now, I want to provide you with a specific action plan that you can implement starting today and follow for the next 30 days. Week 1. Your sole mission is to eliminate all sugary beverages. Replace sodas and industrial juices with pure water, water with lemon, or unsweetened green tea. Limit your coffee to 1 morning cup, and each day consume a portion of low-sugar fruits such as blueberries, strawberries, or whole apples. Focus exclusively on these changes for 7 days. Week 2. Completely eliminate processed meats. This means no cold cuts, no sausages, and no ham. Replace them with fresh fish, skinless chicken, or legumes. Introduce fatty fish at least twice this week and diligently maintain the changes implemented in the first week. Week 3. Integrate anti-inflammatory foods into your diet. Add a daily serving of avocado. Consume a handful of nuts such as walnuts or almonds. Use olive oil in your salads and practice mindful hydration. Drink water throughout the day, but consciously reduce your fluid intake for 2 hours before bedtime. Week 4. Incorporate gentle physical activity. Aim for a daily walk of at least 20 minutes and practice pelvic floor exercises such as Kegel exercises. These exercises strengthen the muscles that control your bladder. At the conclusion of these 30 days, critically evaluate your progress. How many times are you now waking up at night compared to before? Has the force of your urine stream improved? Do you experience fewer urgent urges? Are there fewer instances of leakage? If your answers are affirmative, you are on the correct path. Should you find that after 30 days there is no improvement, or if your symptoms worsen, it is then advisable to consult your urologist for a comprehensive evaluation. While these dietary changes are powerful, they are not a substitute for professional medical diagnosis. Now, I need to clarify something of extreme importance. All the information I have presented is grounded in robust scientific evidence and my extensive clinical experience treating men with prostate-related conditions. However, these measures are primarily preventive and conservative. They do not replace medical treatment. If you experience blood in your urine, severe pain during urination, fever, an absolute inability to urinate, or a sudden and complete loss of bladder control, you must seek immediate emergency medical attention. These are critical warning signs that necessitate urgent intervention. If you have a history of prostate cancer, are undergoing oncological treatment, or if your PSA levels are elevated, it is essential to discuss any drastic dietary changes with your specialist beforehand. However, for the majority of men experiencing mild to moderate symptoms, these dietary adjustments are safe, highly effective, and can bring about a transformative improvement in your overall quality of life. Gentlemen, the very fact that you have engaged with this entire video signifies an act of bravery. It demonstrates that you have not resigned yourself to your condition, that you are not accepting that your prostate dictates your life, and that you are willing to make proactive decisions that will enhance your future well-being. Now, here is the unvarnished truth. The true adversary to your prostate is not hidden in some mysterious location. It resides on your plate, in your refrigerator, and within the daily habits that you repeat thoughtlessly. However, the extraordinarily positive news is that you possess complete agency to alter these habits. Eliminating added sugars and industrial beverages, moderating full-fat dairy and processed meats, and reducing caffeine and alcohol consumption are not complex decisions. They are straightforward choices with profound and lasting consequences. If you diligently implement the 30-day plan I have outlined with discipline and consistency, you will begin to witness tangible results. Fewer urgent urges, fewer nighttime awakenings, increased urinary flow strength, and a greater sense of control over your body. This is not an empty promise. It is about recalibrating your body's biochemistry to work in your favor. If this video has been beneficial to you, if you feel that for once someone is explaining the truth without reservation, please show your appreciation by liking this video and subscribing to the channel. My mission is to provide you with reliable medical information that you can genuinely implement. In the comments section below, please share which of these 3 enemies you are currently consuming and which one you intend to eliminate first. I am eager to read about your experiences. Your prostate does not define who you are, but the decisions you make today will unequivocally shape how you live tomorrow. Take excellent care of yourself.